Greetings. This is your dietitian, Mission of Health and Wellness. Thank you all for taking the time to listen to what I have to say concerning high blood pressure. As you might notice, the question is high blood pressure a symptom or a disease? If you have been enjoying and learning from some of these videos that I've been posting, I want you to go ahead and subscribe, like, share, and use the comment to communicate with your personal dietitian. You can also follow me on Facebook, and it's under my name, Paula Allison, or you can find me on my website. It's myhealthconnectionllc.com. Let's first, before we begin, look at the definition of what high blood pressure is. So high blood pressure is the pressure of the blood against the wall of the arteries that's in your body. So it's just a pressure. A lot of times we go all over the place because we're trying to figure out what is high blood pressure. It is just the pressure against the wall in your arteries. The rise in blood pressure is telling you that your body is sick. There's something wrong and you need to fix it. And your pressure goes up naturally to properly adapt to what's going on, because we have a unique body. We were given a body from the Creator that can heal itself if we give it the right condition. If you cut your finger, you expect your finger to heal. So why can't we expect that when our numbers are going out of control because there's something going on in our bodies, in our arteries, that it cannot be fixed? So let's look at this. Let's break it apart. As your heart beats, it creates a force into the muscle walls of your blood vessel that's going to deliver the blood throughout your body. It's going to deliver oxygen and nutrients to every part of your body's tissue. When your heart pumps the blood into the arteries, this is called the diastolic blood pressure, which is the top number. And usually this number is usually ranged between 110 and 120. Now, when the heart is resting in between beats, this is called the diastolic pressure. Usually, you can see this number between 70 and 80. So let's look closely at the circulation system. I explain the circulation system to my patient as their plumbing system, because sometimes the medical system seems to speak over our heads. So I try to bring it down where my patient can understand it. So whenever I have a patient that has an issue with high blood pressure, I bring them back to their plumbing system at home. So I let them know there's a few things that can cause problems in your circulation, problems or your plumbing system, so that can change your blood pressure number. So the first one is the properties of the fluids, where the blood gets thicker, which will require your heart to pump harder to get that oxygen and the nutrients to your body's tissue. I want you to now look at it now. Let's go into your kitchen. And I want you to look at what's happening into your sink. Say, for instance, you cook some rice or you cook some food, you pour it down your pipes in your sink. It's going to clog it up. It's going to get thicker. Oil, you pour oil into it, or oily foods. Fat, it's going to get thick. So if you had to get a plunger and start plunging that sink, it's going to take some heavy plunging for you to move that thickness out of the way so that it can flow and so your pipe could flow freely. It's the same thing with your blood pressure. When your arteries are starting to get thickened or clog up, your heart has to work harder. And when your heart is working harder, your blood pressure numbers go up. Okay, that is one. Second of all is extra fluids that gets into your arteries. And you might ask yourself, how do they get there? It gets there from a high salt diet. So now a salt increase water retention and cause extra fluids and increase your blood volume and your pressure. And that makes your heart works harder and your pressure goes up. Sometimes it causes swelling of your ankles, and they call it edema, or you have swelling of your hands. So these are some of the things that are happening. So second of all, stress. We may not realize that stress releases hormones in our bodies from your adrenal system, and that increases your heart rate and it elevates your blood pressure. What it does, it constricts your blood vessels, so it doesn't make your blood vessel expands appropriately, that the way we were made for that to happen. So, and this is like a natural fear-based response to make your heart temporarily beat faster and work harder. But what happened is that between life stresses or jobs or family or finances, things that we think we can't change, but we can change them. Those are the things that cause our body to go under stress. And 24/7, we constantly keep putting our body under stress. And what happened? Our blood pressure goes up. Okay, the next one is narrowing of the arteries. Again, let's go back to your pipe. If you have a pipe in your kitchen or even your bathroom, and the pipe keeps getting narrow and narrow, the heart's gonna have to pump harder again to get that blood through a smaller passage. Same thing, if you have a plunger, you're gonna have to plunge harder to get that through it. And what is clogging up your pipes? What is clogging up your arteries? Your pipe, maybe the food you're pouring down your sink. Again, rice swells up. That's why your mother always tells you, don't put rice down the sink. Put it in a pot, let it soak, and then dump it in the garbage, after it swells up. Or oil, don't pour oil in your sink. It's the same thing. Don't pour oil in your arteries. Don't pour fat in your arteries. Don't pour processed foods in your arteries. So when you take these foods in, it's affecting your plumbing system. It's affecting your arteries, your circulation system. So you really want to make sure that we're unclogging our pipes or arteries. You might be saying to yourself, but wait a minute. If all this is what's causing my blood pressure to go up, why not I just remove them or change them? But no, what you do, or like most of my patients, they go to their healthcare provider, their numbers are up, the healthcare providers don't sit them down and said, okay, Mrs. Brown, let's look and see what's going on in your life. Are you having financial issue? Are you having family issues? Are you very stressed on your job? Maybe you need to see if you can change some of these things. Or maybe you want to go to a dietitian and see if maybe they could come up with a plan, the both of you, and within 30 days, if you don't get your pressure done, then come back to me. But no, you're given the option of medication. And I'm saying all healthcare providers does this. Not all, but majority of healthcare providers will give you a medication. So medication should not be the first defense when your pressure starts going up. The correct action for a high blood pressure is a lifestyle change to get to the root cause of what's having your numbers to go up. So I challenge you today, every one of you that are listening to me, buy a blood pressure machine. I know I see them on Amazon for about $20-something. I know you can't, because of COVID, we can't go to Walgreens or Walmart and stick our hand in the little machine and check our pressure. And you don't want to wait till you go to the doctor to get your blood pressure tested. So I challenge you, get a blood pressure machine, start testing your blood pressure, see where your numbers are. If your numbers are going outside of the normal range, what I want you to do is start learning how to reverse and or even prevent high blood pressure. I use lifestyle change with my patient to reverse blood pressure. Patient has come to me with blood pressure over 160, over 90. Even myself, my testimony, when my blood pressure started going up, because I had a very stressful job. I have a very high stress, high power position. And one day I was sitting at my desk, and a friend of mine, which is also a dietitian, I said to her, I don't feel good. I feel like there's something sitting on my head. And she said, let's go over to the clinic, get your blood pressure taken. When I went there, my blood pressure was 190 over 110. Everybody panics. All the healthcare providers are panicking. Oh, you got to start you on blood pressure medication. We've got to give you something for it. I said, no, I have to get to the root cause of why is my pressure high? Why is it? And as you realize that my pressure got that high before I even realized it. So that's why it's called a silent killer. So because I have the experience and I have the knowledge about how to reverse and to prevent these chronic disease, and one like high blood pressure, I went into full gear. And today I can tell you that my blood pressure is about 105 over 70 something. Does it ever move and go above that? Yes. If I go outside of doing what I'm supposed to do, it will get there. So I do not go back to the life that brought me to those numbers. So I do understand what you're going through, and it's not easy, but I know that it can be done. So the root cause, to get to the root cause of your problem, to correct the blood pressure. Now, somebody might say, well, this hasn't been done. Yes, it has. I challenge you again to go to Google and put in this name, Dr. Walter Kempner. The last name is Kempner. In 1940, he created a rice diet to help to reverse chronic disease like hypertension. He was a German doctor. And what he did, he took the patient that was critically ill and he put them on a short-term way of eating. They call it a rice diet. And again, you can research it and see 1940. And what he did, after he kept them on a short-term base, because he wasn't quite sure what the diet was going to do. So after the program had ended, he told all his patients to go home, continue the diet for 2 weeks, and to come back to him. There was a lady, a 33-year-old lady from North Carolina. She had chronic kidney disease. She had eye disease. And because the doctor's accent was so strong, he was a German, she thought he said, come back in 2 months. So she never came back to the doctor until 2 months. When she came back, her eyes have gotten better. Her blood pressure went from 190 over 120 to 124 over 84. So all of a sudden, the doctor was like, my goodness, this thing really works. So he started now going longer term and start taking patients that were not that critically ill. Their blood pressure might have just started to go up, or maybe like 160 over 100, and using that diet to reverse high blood pressure. So let me answer the question with you today. High blood pressure or hypertension is not a disease. It is a symptom of something gone wrong in our body. Remember, as a dietitian, I have been given, all of us, I myself as a dietitian, you out there that's listening to me, you have been given a body that can heal itself if given the right condition. I am not the healer. I am just the messenger with the news of hope to let you know that your health and mine are God's success and reputation. God needs you and I to be healthy and to be prosperous. So I want you to start looking at what you're doing. Start testing your blood pressure. Start monitoring it. Start working with your healthcare provider. If you need any additional information, any help in trying to reverse or even to prevent high blood pressure, I need you to give me a call, or you reach out to me, make comments, send me a comments. And I always leave my patient and said blessing, healing, and health. And may God bless you and keep you.